Hello everyone, today we'll be talking about anemia and the cardiovascular system. Let's start by describing what anemia is. Anemia is a condition in which your body either does not have enough healthy red blood cells or does not have enough hemoglobin, which is a protein that helps carry blood to other organs. In terms of causes, anemia can be the result of the body not making enough hemoglobin or not enough red blood cells. Excessive bleeding can cause a loss of red blood cells and/or hemoglobin, or the body can destroy existing red blood cells, again leading to anemia. One of the more common causes of anemia is a lack of iron, which is needed to make hemoglobin. Also, individuals with deficiency in B12 can struggle with making enough healthy red blood cells, leading to anemia. There are more severe anemias, such as sickle cell anemia, which is when one's red blood cells are crescent-shaped rather than round. Anemia can also be caused by bone marrow issues and chronic inflammation. To diagnose anemia, usually your family physician will order blood work to see your red blood cell count and the integrity of your red blood cells. A hemoglobin test might also be used to see the level of hemoglobin present. Depending on how severe one's anemia is, the symptoms can vary. However, some general symptoms include tiredness, weakness, shortness of breath, pale or yellowish skin, which might be more obvious on white skin than on individuals of color, irregular heartbeat, dizziness or lightheadedness, chest pain, cold hands and feet, as well as headaches. Again, if someone has severe forms of anemia, these symptoms can heavily impact their quality of life. Treatment for anemia varies. If the anemia is due to low iron or low B12, iron pills and/or supplements can be used. In more severe forms of anemia due to chronic or inflammatory conditions, more direct disease management would be required, and again would vary based on person.
As you can see, when the body is anemic, there are fewer red blood cells or hemoglobin. Because of this, the heart has to work a lot harder to deliver oxygen through the blood to the tissues in the body. Since there are fewer red blood cells or less hemoglobin to carry oxygen, the heart compensates by increasing its rate and pumping out more blood. This increased cardiac output helps maintain oxygen delivery but puts an additional strain on the heart. Over time, this constant strain on the heart can lead to structural changes in the heart. One of the significant changes that comes from additional strain is left ventricular hypertrophy, which is essentially when the walls of the heart's left ventricle thicken as it's working harder to pump blood out to the whole body. If anemia persists, or in many chronic cases, anemia can lead to heart failure, a serious condition where the heart can no longer effectively pump blood out to fulfill its body's needs. An additional aspect we can think about when connecting anemia to the heart is the fact that the heart is also made up of tissues. Anemia can reduce the oxygen reaching these specific tissues and can cause symptoms like chest pain, shortness of breath, and dizziness.
So why is anemia more common in women? So the primary reason is menstruation. So heavy menstrual cycles can lead to a lower red blood cell count and worsen anemia. And then also during pregnancy, women need nearly double the amount of iron as opposed to when they're not pregnant. So this puts pregnant women at a greater risk, where in fact 1 in 6 pregnant women tend to develop anemia. So with regards to anemia in women and how it specifically affects the female cardiovascular system, as we know, hemoglobin carries oxygen to the rest of our body. And anemia, which is low red blood cells or low hemoglobin, leads to less oxygen transport throughout the body, and this can lead to chronic fatigue, which is particularly more common in women. And if left untreated for too long, this can also progress to irregular heart rhythms and cardiac symptoms.